Bismillahirrahmanirrahim. Quote of the day: Who is the most favored of God? He from whom the greatest good comes to his creatures. I'm Dr. Muneeb Altaf, and today I'm going to discuss about the measures for health protection of workers and prevention of occupational diseases under the supervision of Professor Dr. Saira Afzal. Occupational health. So, what is occupational health? The promotion and maintenance of highest degree of physical, mental, and social well-being of workers in all aspects. Complete health of all at work is the modern definition of occupational health provided by the International Labor Organization and WHO. So these are the different indicators, which is the physical, financial, social, and emotional. These are the different factors which affects at the employee well-being. International Labor Organization standard and policies. The following three fundamental concepts which are given by the ILO. Number one is a workplace should be safe and healthful. Number two is working conditions should be respectful of employees' well-being and human dignity. And number three is jobs should provide genuine opportunity for advancement and fulfillment. Health promotion. Scientific evidence shows that in long term, work related stress can contribute to musculoskeletal disorder, hypertension, and cardiovascular diseases. It can lead indirectly to problems in and outside the workplace, such as violence, the abuse of drugs, the alcohol, strained family relationship, depression, physical and mental health disorder, and even suicide. However, the early detection and appropriate treatment of the incipient occupational and non-communicable diseases will reduce the mortality and lower the frequency of the disability. The prevention of occupational accident and diseases, the promotion of a healthy working life, and building of a preventive culture is a shared responsibility of government, employers and workers, healthcare professionals, and as a whole society as a whole. Health promotion in a workplace contributes to the improvement of the work organization and working environment, social dialogues, and the and participation of the social partners. The promotion of the health among all workers, their family, and their communities, and encouragement of the personal development and well-being by the enabling workers to reach a higher level of self-determination concerning their health and improvements. Health promotion benefits both for the workers and employers, improving workplace productivity and performance, and the long-term well-being of workers and their family, and reducing pressure on health, welfare, and social security system. International Labour Organization and WHO recommendation on the occupational health are the measures for the general health protection of the workers was the subject by the of discussion by an International Labour Organization slash WHO Committee on Occupational Health in 1953. The committee recommend the following measures. Number one is nutrition. Number two is communicable disease control. Number three is environmental sanitation. Four is mental health. Five are the measures for the women and children. Six is the health education. And seven is the family planning. Now we will discuss one by one. Nutrition. The nutrition of the workers must be a concern of the occupational health program. All the workers should be nourished adequately, including any special demands. To achieve this, worker should be paid handsome pay package to purchase food for himself and his family. Workers should be educated about the composition of the balanced diet. Facility of canteen at the workplace when worker exceed a certain number, and provision of subsidy on the food, a separate and good sanitation condition and dining room for meal is a good practice. Facility for the storing food is in uncontaminated condition should be provided. Number two, which was the communicational disease control. The industry provides an excellent opportunity for early diagnosis, treatment, prevention, and rehabilitation. It is a general objective everywhere to detect the cases of communicable diseases and to render them non-infectious to others by treating or removal from the working environment or both. So there should be an adequate immunization program against preventable communicable disease like anthrax, andulant fever, and Q fever are the example of communicable diseases which may be of occupational origin. Number three was the environmental sanitation within the industrial establishment. The following needs attention for the prevention of the spread of communicable diseases by water, food, or some other means. So, considering the water supply, a sufficient supply of wholesome drinking water is one of the basic requirement in all industrial establishment. The common glass tumbler for drinking water should be abundant as its infection spread. So installation of the drinking water fountain at the convenient point should be encouraged. Number two is the food. Food is solid and its sanitation, preparation, storage, and handling should be essential for industry. Number three is the toilet. It is recommended that there should be at least one sanitary convenience for every 25 employees, male or female separate, for the first 100 employees, and therefore one for every 50 employees. So plant cleanliness, the walls, ceiling, and passages should be painted with the water washable paint and repainted at least once in 3 years and washed at least once in every 6 months. The dust must settle down on the floor and machinery should be promptly removed. Number five is a sufficient space for the worker. So sufficient floor space and cubic space are essential to prevent not only the respiratory infection but also to ensure a comfortable working environment. So the recommended standard is of the minimum of 50 cubic feet of space for every worker. Six is the lightning. The result of poor industrial illumination are the workers' eye fatigue, increased accident, decreased production, and more rejection of the finished work. Furthermore, defective illumination over a long period of time may result in permanent impairment of vision. So there should be sufficient and suitable lighting, natural or artificial or both, in every part of the factory where workers are working or passing through. Number seven is the ventilation and temperature. It is the protection against the hazard, and number nine is the housing. So fourth point of the International Labour Organization was the mental health, and the goal of the mental health in industry are to promote the health and happiness of the worker and to detect the signs of emotional stress, strains, and to secure the relief of stress and strain where possible. And the treatment of employees suffering from mental illness, rehabilitation of those who have become ill. Mental health is more than the absence of the mental illness. Mental health aids in coping with the stress. Workplace wellness must be a top priority, and you cannot have health without a mental health. So mental health is as important as that of the physical health. Measures for the women and children. Women workers require special protection because the developing embryo may be more susceptible to noxious agents than the exposed mother, as in a case of methyl mercury poisoning. The female may be less suited for some work tasks than the men, and the infant mortality is higher among the children of the women employed in the industrial work. Following provision should be given to the woman: paid maternity leave of 12 weeks, provision of free antenatal, natal, and postnatal checkup, prohibition of work at night, and prohibition of work in dangerous occupation like mining. The minimum age for employment in Pakistan in various provinces are in the Punjab it's 15 years, since it's 14, in the KPK is 14, and in Balochistan it's 14. Minimum age for hazardous work in Balochistan is still 14, while it is raised to 18 years in rest of the provinces. Number six point, which was given by the ILO, is the health education. Health education in the industrial setting should be emphasized at all levels: the management, the supervisory staff, the worker, the trade union leader, and the committee. Number seven point is the family planning. Family planning is now recognized decisive factor for the quality of life, and this applies to the industrial worker as well. The worker must adopt the small family norms. So the prevention of the occupational diseases, there are medical measures, there are engineering measures, and there are legislations for the prevention of occupational diseases. Medical measures are pre-placement examination, periodical examination, medical and healthcare services, the notification, supervision of working environment, maintenance and analysis of record, health education and counseling. Now, the pre-placement examination. The purpose of pre-placement examination is to place the right man in the right job so that the worker can perform his duties efficiently without detriment to his health. It is done at the time of employment and includes a worker's medical, family, occupational, and social history. A fresh recruit may either be totally rejected or given a job suited to his physical and mental abilities. Following is a list of some occupational in which it is risky to employ men suffering from certain diseases, like in the industry of lead, the employee having anemia, hypertension, nephritis, or peptic ulcer should not be hired in the lead industry. Same as that in the rest, in the dye industry, asthma, skin and bladder patients. In the solvent industry, there should be the liver and the kidney diseases, dermatitis and alcoholism disease patients should not be hired. In the industry of silica, healed or active tuberculosis of lung disease or chronic lung disease patient should not be hired. And radium and x-ray industry, the sign of illness, especially any blood disease patient should not be hired in the radium and x-ray industry. Periodical examination. Many diseases of occupational origin require months or even years for their development. Their slow development even often leads to their non-recognition in the early stages, and this is harmful to the worker. This is the reason why periodical examination checkup of the worker is very necessary when they handle toxic or poisonous substances. Medical and healthcare services. The medical care of the occupational disease is a basic function of an occupational health services. Social security institution in Pakistan provide medical care not only for the worker but also for their family. Within the factory, the first aid services should be made available, and properly applied first aid can reduce suffering and disability and hasten the recovery. Notification. The main purpose of notification in industry is to initiate measures for prevention and protection and ensure their effective application. To investigate the working condition and other circumstances which has accused or suspected to have caused occupational disease. Supervision of the working environment. The physician should pay frequent visit to the factory in order to uh, attain himself with the various aspects of the working environment, such as temperature, lighting, ventilation, humidity, noise, cubic space, air pollution, and sanitation, which have an important role on the health and welfare of the worker. And he should be acquainted with the raw material process and the product manufacture. Maintenance and the analysis of the record. The worker's health record and the occupational disability records must be maintained. Their compilation and review should enable the service to work over the health of the workers, to assess the hazard inherent in certain type of work, and to devise or improve the preventive measures. Health education and counseling. Ideally, health education should start before the worker enters their factory. All the risks involved in the factory in which he is employed and the measures to be taken for the personal protection should be explained to him. And the correct use of protective device like mask and gloves should be uh, explained. In now comes to the engineering measure after the medical measures. The engineering measures are the design of the building, good housekeeping, general ventilation, mechanization, substitution, dust, enclosure, isolation, and protective devices. Design of the building, the type of floor, walls, height, ceiling, roof, doors, windows, cubic space, all of these are all matters which should receive attention in the original plan of the building, which is put up by the industrial architect. And good housekeeping covers the cleanliness, ventilation, lighting, washing, food arrangement, and general maintenance. Ventilation, it has been recommended that in every room of a factory, ventilation opening should be provided in the proportion of 5 square feet for each worker employed in such room. Opening shall be such as to admit a continued supply of the fresh air. In room where dust is generated, there should be an efficient exhaust ventilation system. Mechanization, the plant should be mechanized to fullest possible extent to reduce the hazard of contact with the harmful substances. Dermatitis can be prevented if hand mixing is replaced by the mechanical devices. Acids should be conveyed from one place to another through pipes. Considering the substitution of white phosphorus by phosphorus uh, sequoia in the match industry, which resulted in the elimination of necrosis of jaw. Zinc or iron paints can be used in the place of harmful lead paints. Dust can be controlled at the point of origin by water spray or wet drilling of the rock. Inclusion of a little moisture in the material may make the process of grinding, sieving, and mixing comparatively dust-free. Enclosure. Enclosing the harmful material and processes will prevent the escape of dust and fumes into the factory atmosphere. Grinding machinery can be completely enclosed. Such enclosed units are generally combined with the exhaust ventilation. Isolation, it is necessary to isolate the offensive process in a separate building so that the worker not directly connect with the operation are saved from the exposure. Protective devices, the devices comprises respirator, earplugs, ear muff, helmets, safety shoes, aprons, gloves, gum boots, barriers, creams, screens, and goggles. All are these are the protective devices which can be used in the different industries at the different sites. The worker should be instructed in the correct use of these devices. Now comes to the legislation of the occupational diseases. Directorate of the Labor Welfare Pakistan. These are the different laws which are the Dock Laborers Law Act 1934, Act 1923, then the Khyber Pakhtunkhwa Worker Compensation Act 2013, Sindh Worker Compensation Act 2016. So these are the different legislation which has started from 1923 to almost 2015 and 2016. So these are the different acts, ordinance, rules, and laws which are used in the labor welfare. Directorate General of the Labour Welfare Punjab. It is a focal agency for the implementation of the labour law in the province. It has a wide range of function and responsibility that are given below. The maintenance of the industrial peace and harmony in the Punjab, the settlement of the industrial disputes through the process of conciliation, arbitration, and adjudication, coordination with the district labor and human resources boards, and the implementation of the government policy in this regard. Manage the claim of the compensation and the cases of non-payment of the wages. Conducting of the referendum for collecting collective bargaining agents and trade unions and federation elections, audit and scrutiny of the annual returns of funds of the trade union and federation, enforcement of labor welfare law on the factories, transport, railway, shops, commercial and industrial establishment, implementation of the government policy and programs for gradual elimination of the child labor, coordination of the government efforts combating the issues of the child labor and bonded labor. And number 10th point which are managed by the government is the registration and the deregistration of the factories, shop, and the commercial establishment, enforcement of weight Mayer's law, factories, shop, establishment, including the petrol pumps, training in the various disciplines of the industrial relationship, provision of training, information, and advisory services to industry for improvement of safety and health and working environment, and distribution of the marriage grant, talent scholarship, funeral grants, and management and distribution of the education, allotment of plots and state management of the labor colonies, and promotion of employment opportunities, collection and dissemination of the labor market information, and assistance to the defense forces by the provision of data on the skilled personals. Punjab Employees Social Security Institute PESSI is an autonomous body under the administrative control of Labour and Human Resources Department under the Punjab Government Rule of Business 1974, established through the Provincial Employees Social Security Ordinance 1965. Benefits which are provided by the PSSI are the medical facilities. Medical facilities include comprehensive medical treatment in the Social Security hospital, and the facilities not available in the Social Security hospital are managed through the other hospital at the cost of PESSI, wherever those be available. In case the required facilities are not available within the country, the same are managed abroad to cater to the health requirement of the secured person. Cash benefits which are given by the PESSI is sickness benefits, injury benefits, iddat benefit, maternity benefit, gratuity, disablement pension, survivors pension, artificial parts, funeral grants, financial assistance, and free education for the secure workers' children. 1st May, which is the Labor Day, is an annual holiday to celebrate the achievement of the worker. Now it's time for the recent updates. Are employed female worker at the increased burden of occupational injuries and diseases. First comprehensive study at the national for the Pakistan, which was published in the 3rd of February 2023. It says that this study is to investigate the trends of occupational diseases among female employed workers between 2001 to 2 and 2020 to 2021, and compare the burden of the occupational diseases with male employed worker suffered in OID in Pakistan. So overall, as compared to male employed worker, occupational disease year trends of female moved upward to 2012 to 2013 and decreased gradually afterward. So as compared to male employed worker, Occupational injury and disease index value among female professional services workers, shop, market, sales worker, and craft related to the trade worker increased to 300%, to 12% and 193% respectively in 2020 to 2021, increasing the trend of OID among female employed person in comparison to male employed person. Demands specific injury prevention policy and healthcare system, especially for the rural area female employed workers. Now it's time for the MCQs. Number one, a person applied for a job in a sand blasting factory. During his pre-placement examination, he is found to be having pulmonary tuberculosis. What should be the next plan regarding his job? Number A is rejected and asked to work in other sandblasting industry. Number B is rejected and advised to do some other job in other kind of firm. Number C is recruited and advised to get medical treatment. Number D is recruited on low wages as he cannot work properly. Number E is recruited on high wages so that treatment can be done. So which one of the following should be further planned regarding his job?
B.
C.
B is the right answer. Rejected and advised to do some other work in other kind of firm. Question number two. Mr. John works in a cement factory where his work is to load the cement bags on the loading trucks. While loading trucks, he got severe back pain. The physician, after investigation, diagnosed that he suffered from a disc slip. He advised a medical leave of 2 weeks. What is the what is recommended to do when he returns back to work? Number A, join his previous work immediately. Number point B is medical examination after the leave, then the decision is made. C is he cannot do any type of work now. D is he is fit for any type of work. E is leave his previous work and join the new work. The answer is B. Medical examination will be done after he came back to work. Then the decision will be made whether he is now fit for the work or not. Number six, which of the following health indicator is not included in the International Labour Organization or WHO definition of the occupational health? A is physical, B is mental, C is social, D is economical, and E is family planning. So according to definition of the occupational health, social is the point which is not included in the definition by the ILO. Number four, a new cotton factory is planned to be constructed in a town where 80 laborers will work. How many toilets should have to be built in that factory? A is 1, B is 3, C is 5, D is 7, E is 10.
C.
B is the right answer. There should be one for every 25 workers, as we have discussed in the previous slides. So, according to that, in the first 50 laborers, so three toilets should be at least there for that workers. Question number five, which of the following medical and engineering measure is of no use for health protection and prevention of occupational disease in workers? Use of less toxic substance, use of plastic pipes for transportation of acids, good ventilation of plant, dry cutting of the marble, and safe electrical wiring. Which one of the following is of no use? D is the right answer. It's a wet cutting for the marble should be done for the prevention related to the health diseases. Question number 6. A new mobile assembling unit is planned to be constructed. Which of the following is of no benefit for efficient and productive benefit performance of the worker? Number A is provision of retirement benefits. B is good lighting in the working room. C is minimum working space of 50 cubic feet per worker. D is facilitation of the facility of canteen. E is swimming pool in the factory. Is the right answer. Working space for the 50 cubic feet. A textile factory is recruiting 500 new workers. Which of the following things shall the factory owner keep in mind while recruiting the workers? Number A is equally appointing the male and female staff on the night. All the factory employees should be 12 years or more. A facility of 10 weeks paid maternity leave. A minimum wages of 12,000 per month. And number E should not consider the health of the worker. So which one of the following should he kept in mind before recruiting or starting the company?
B.
D is the right answer. At least at the start, minimum age wage of 35,000 nowadays, which are being considered. So minimum wages should be considered first. Number 8, a firm where 1,500 workers are contributor hired a physician of periodical medical examination of the worker. Which of the following is correct regarding the periodical examination? A is no need of examination. B is no need to evaluate those coming back after medical leave. C is it is compulsory as many diseases present late or require months or years to develop. D is should be done at least after 2 years. And E is physician hiring is just to meet the firm establishment criteria. C is the right answer for the periodical examination. It is sometimes it is compulsory as some diseases present late or require months to develop. Question number 9. Engineering approach is followed to prevent the accident at workplace by giving due consideration to physical and mental limitation of the worker. By number A is imposing too many safety rules. B is not permitting to make a safety device. C is giving first aid in case of injury. D is giving constant attention to how a worker is likely to react. And number E is followed just to hire the engineers. Number D is the right answer. Engineering approach is done by giving constant attention to how a worker is likely to react to the different situations. Question number 10. Which preventive measures are of no use to control the spread of communicable disease in a workplace? A is common glass tumbler for drinking water. Number B is vaccination of the employees. C is workplace should be free of dust. And D is a common dining room for lunch inside the workplace. And E is good sewerage work at the workplace. So which one of the following is of no use? D is the
C.
right answer. A common dining room for lunch inside a workplace is not is related to spread of the communicable disease. This is the key, and this is the YouTube link. Please like and subscribe, and thank you. Any questions?
Thank you so much, Dr. Muneeb.